Hi, my name is Elizabeth Wood. I'm a junior at Shaker Heights High School in the Science Internship Program for Nursing at Hillcrest Hospital's Perioperative Unit. The title of my project is How Do Families of Surgical Patients Perceive Communication of Their Family Members' Surgical Status? The researchers acquired background knowledge through a literature search before the project began. The background knowledge is communication between nurses and family members throughout the perioperative process impacts the patient experience. Effective communication can relieve anxiety and improve the experience for patients and families. Data suggests that communication, especially from a nurse, is the factor most highly correlated with a positive healthcare experience. The purpose of this study was to enhance the communication process between nurses and family members before and after surgery. To begin the study, it was approved by the Cleveland Clinic IRB. Patients and families were provided information sheets about the survey on the day of surgery. A random sampling of all surgical patients with family members present were selected. This study excluded ophthalmology, pediatric, and intensive care patients. After obtaining informed consent, the family member was interviewed in a private consult room by one of the investigators following their visit with the patient. Data regarding the patient's length of stay was collected, and to protect confidentiality, all documents were coded and securely maintained. Quantitative data was analyzed with descriptive statistics. Researchers worked as a team to analyze qualitative data, identifying the most common categories in participants' responses. The genders of family members were 58% female and 42% male. 51% of all family members interviewed were Caucasian, 27% African American, and 22% other. 63% of the family members were a spouse to the patient, 12% were a parent, and 25% other. All data and percentages are taken from a survey group of 43 family members. 42% of those interviewed did feel well informed, and one person did not feel well informed. 10 people talked to a nurse in the pre-op area, 2 talked to a nurse in the post-operative area, 8 people talked to a doctor, 7 reported talking to a nurse, 2 reported talking to both a doctor and a nurse, and 14 did not report talking with a nurse. 15 people reported physical environmental issues, 8 people requested more information, 3 requested more frequent information, and 19 said nothing could have improved the experience. 98% of people reported feeling well informed, while 2% of all people reported not feeling well informed. 32% of people interviewed did not report ever talking to a nurse. The mean satisfaction score regarding communication was a 7.5 out of 10. Family members said, "I wish a team member or a nurse came to inform us. I think it was pretty pleasant. When I saw blue on the op time board, I got anxious to hear something. It was a really good experience. PACU was a little too long and uninformed. I thought a nurse would talk to me. I'm a nurse. And I felt like I could leave this area." In conclusions, the family members' perception of communication was overall satisfactory. The survey gave family members an opportunity to discuss other information that would improve the overall experience. The Department of Surgical Services' current communication system proved to be effective for the majority of those surveyed. Family members expressed satisfaction when utilizing the op-time board and the waiting room pagers. Communication was perceived as effective regardless of the informant. Some implications of the study will be further education of all staff on effective communication techniques, to report the information perceived from family members to the appropriate departments to improve overall experience, to increase the consistency of the information provided to family members, to ensure the accuracy of information provided to family members, and to improve the scores of family satisfaction with nurse communication. Some recommendations are to continue the study to increase the sample size, to clarify the primary subject of the study, to provide a more convenient location for the interview to decrease time away from their family member, and to conduct a comparative study with perioperative units in other hospitals. And I would like to thank my family, my mentors, and the Office of Cleveland Clinic Civic Initiatives for giving me this opportunity this summer.